Well, thank you, everyone, and good afternoon. Today is May 22nd, 2020. This is our community and media update and briefing. Want to just begin by, of course, recognizing this upcoming weekend and, of course, Memorial Day. First and foremost, obviously, it's a solemn time. We remember all the brave men and women who we have lost, to those that have been protecting our country, protecting our freedoms, our ability to be a community. And so I know we're going to celebrate this weekend with family and friends, I'm sure, in our own different ways, but we're going to be, of course, with family and friends. Let's also think about all of those brave Americans that gave their lives and who we remember today and throughout the whole weekend, really, as we lead up to Memorial Day, their contributions and sacrifices. And also as a reminder, this weekend, while we are honoring Memorial Day, it's also important that we're staying safe this entire weekend. Moving forward, it's really about taking safety into our own hands, knowing that when we are outside our homes, there's always risk, and that we are minimizing those, and that we're taking care of the most vulnerable in our community. So please, let's continue to be safe. COVID-19 is still out there, and it's still affecting people, and in some cases, taking their lives. Let me begin with some data of the snapshot of today. And then I want to talk about some broader data. Joining us is Kelly Colopy, who is the director of our Long Beach Health Department. She's going to be able to answer questions that relates to the health data, but also has some data to review of her own. Of course, have Alice, who's going to do our Spanish translation at the end, our recap, and then Paola, who's doing our ASL as well. So as of today, we have 1,513 residents who've tested positive, 1,024 who have recovered. Today, we lost 2 additional Long Beach residents. Both had underlying health conditions. Our prayers and thoughts go to them and their families. And it brings the total deaths in Long Beach to 70 of COVID-19. And again, it's COVID-19 is the leading cause of death as it relates to Long Beach, whether you're looking at any given year on homicides or car crashes or other serious fatalities. Of the 70, 55 have been associated with long-term care facilities. So 2 weeks ago from today, we began relaxing our safer at home orders and guidelines. And it seems like a much longer time ago, but it's been 14 days since we made some significant changes to those orders. And as you remember, we essentially moved into the governor's announced stage 2. And so we had met the stage 1 preparedness. Now we were in the second stage. And what that meant for us is, of course, reopening a bunch of curbside retail. We'd already been doing the restaurant retail. We also opened up some manufacturing opportunities, and we opened up a lot of recreation across the city. So public trails and walkways. Of course, we opened up beach paths, beach trails. Our beaches are now open for active recreation, nature trails, golf courses, active recreation, tennis centers. And so that all began to happen 2 weeks ago over the course of a few days. And through that time, I want to first begin by thanking all of you for doing the right thing and for continuing to be safe. We still have folks that need to follow the rules a bit better, but most people are doing the right thing and keeping folks safe. And we shared some analysis a couple of weeks ago as to how we were doing, so I want to update folks on those. And I want to start with going through these indicators. These are the indicators and the data that we're using to see how we're doing and how we can continue to move forward for additional openings as they are allowed through the state. So let me start with this first slide. This is a slide on PPE and supplies. Just as a general update, we've given out over 1.6 have in our supply over 1.6 million PPE in our inventory. Within that inventory, in total, we have given out almost 60,000 N95 masks, 31,000 surgical masks. We've given out about 28,000 gowns and about 13,000 face coverings. And so since this emergency has started, we have really stepped up with PPE. We have inventory out there, but we're still collecting more for all of our skilled care facilities and others. And our PPE goes to first responders, healthcare facilities, long-term care facilities, shelters, and some nonprofits in the city that are doing health work. And so that's the first indicator. Our inventory continues to slowly increase. We continue to give out more PPE, so we have the PPE necessary to stay safe. We had it 2 weeks ago, we continue to have it today, and that's an important indicator as we move forward. The next slide I want to talk to you about is the slide on the number of COVID-19 cases and deaths per 100,000 population. I think everyone can see the slides that are in front of them. The top slide, as you can see, written there is the cases per 100,000. The lower slide are deaths by 100,000. And what you can essentially see is that both cases and deaths, we remain where we are essentially doing slightly better than the county on both metrics, but slightly behind the state also on both metrics. And so while the state overall is doing better than the city continues to outpace the county. And again, these cases and these deaths are all serious. They're all real people and families, but we are doing somewhat better than the county on both of these, but we still have a lot of work to do. So that, again, that snapshot, we showed that graph 2 weeks ago. Now, 2 weeks later, after 2 weeks of reopenings, there aren't significant changes to that data. We are holding steady in the kind of trajectory of our comparisons to the county and to the state of California. I want to take you to this next graph. This is our COVID cases by episode date, and I want to explain this just a little bit. First, we should be all aware that we have dramatically increased our testing capacity. We have 6 testing locations. We've conducted over 27,000 tests at our locations. And I'd like to share one thing that we have that's been a change from the last time we discussed this chart is as testing has exponentially expanded across the state, there have been more and more backlogs that have happened, and every city and county is facing this issue. And so earlier on, we were getting less batches of positive cases at one time because the labs were doing a better job. Today's environment, we are getting cases and batches of cases sometimes days and days and sometimes weeks after. And this has been a statewide issue. It's certainly an issue in Long Beach. And I say that because, as you can see, if you just look at the graph on its own, you could conclude that our cases by episode date are doing better. But the truth is that we are lagged on those. And correct me if I'm wrong, Kelly, but it's your assessment or the health department's assessment that we are likely on cases by episode either holding steady, or in some cases, we might be seeing even more, slightly more cases by episode date than we normally have in the weeks prior. And I think that's been the case if I didn't get that correct. And so while the chart might look better, it looks better than it probably is because of the delays in cases. We're likely holding steady, but also seeing some increases in the cases by episode date. And so that's a critical chart for us to look at. The next chart is one of the most important, and that is hospitalizations. If you look at this chart, you see 2 bars and 2 graphs. One is the hospitalizations as reported, and then the darker one is the updated hospitalization, which is the actual number, because that changes. Again, there are delays, and hospitals will get us the information sometimes, or the coroner or others later than we have them. So, if you look at the darker blue, what you see in hospitalizations is essentially, as the health department has stated, it's generally has been flat. There has been maybe a slight uptick recently. It's too early to tell if that uptick is beginning to decrease some. We need more data. But the health department, Dr. Davis, Ms. Colopy, neither describe what we see in front of us as any type of spike or a significant increase, but generally flat, or perhaps that we may have seen a slight increase, and perhaps we're seeing a slight decrease. We still don't have enough data in this yet. And so, but there is nothing in the hospitalization data that is overly concerning to the health department as far as it relates to where we're at. And so those numbers seem to be generally stable. Maybe they're going up some, maybe they're going down a little bit, but they've been back and forth, quite frankly, over the course of the last couple of weeks. But if you look at, for example, where we are today as to where we are maybe 3 or 4 weeks ago, certainly there is an increase in hospitalizations if you go back just a little bit further. And I think that's pretty clear. Want to talk about the hospital bed capacity, because this is really important, and we look at these at this information every day. We have over 1,500 area hospital beds available. Bed usage right now is at about 60%, so we have room in our beds if we had a major emergency right now or breakout. However, the 60% is higher than it was last 2 weeks ago, which we were closer to 50%. That increase is not a reflection of a large increase in COVID cases. It's a reflection of hospitals allowing some additional types of surgeries, additional types of procedures that are now being allowed or being brought into hospitals. And again, this does not include the surge bed capacity that we have. We have an additional 400 capacity beds for surge capacity. We have our convention center beds that are still available. We set that up a long time ago. We have over 300 ventilators in our area hospitals. And another key metric, still, our ventilators are still at about 30% use. And they were at approximately 30% use 2 weeks ago. So, we want you to know that, that if someone ends up in the hospital and they have a respiratory issue, we do have the ventilators available to take care of them. And so those numbers are really important, because as we've reopened things over 2 weeks, we still have the ventilators are still available. We still have the bed capacity. We have plenty of room in our hospitals, and that's really necessary to give our hospitals the ability to prepare appropriately. And so those are the data points that I shared last time, and I think Kelly can also give some more specifics. But the way that the health team have interpreted the data that where we are today, comparatively to where we were 2 weeks ago, is generally pretty steady. And so what we have not seen is what we have not seen is somehow a surge or spike that is overly concerning to the city. We have also not seen any sort of dramatic improvements to the city either. And so certainly things are generally where they were 2 weeks ago. As I just went over, some of the data might have gone up a little bit. Some of the other data might have improved a little bit. But overall, there has not been any sort of significant changes to the data. Why is that important? Because we actually are at a different place today than we were 2 weeks ago as it relates to reopening. So 2 weeks ago, a lot less was open than it was today. Today, with all the additional active recreation and all the additional reopenings, the fact that we have generally stayed consistent is a positive sign. However, I think there's two caveats to that, which I understand, and I think Kelly understands also. One is 2 weeks of data, when you think about delays and what's happening with the positive rates, is just not enough to know if we really are hitting a plateau or if things are improving or not. And so in the weeks ahead, this data collection continues to be really, really important. Yes, 14 days is the minimum you should be looking at for any trends, but it is literally the minimum is 14 days. And so you've got to go beyond that as we move forward to look at any additional trends. And then the other piece of that is important is besides this kind of snapshot of where we still are very concerned about the cases as far as our positivity rate in the city of Long Beach. That's something that the health department is monitoring very carefully. And we want to continue to watch the hospitalization rate over the course of the next week as well. And so those are all issues that we've got ahead of us. Want to also say, as I turn this over, that again, as a reminder, we have opened, from a retail perspective, a restaurant perspective, what is allowed under the current state health order. We are going to be making, looking at making slight adjustments in 2 areas in the health order, not today, but we're discussing those in the days ahead. One is around drive-through parades or celebrations. These could be maybe for graduations, they could be for birthday parties. I know this is already happening in many places, but we want to create some guidelines also to do it safely and in partnership with the school district. So you're going to see some information on that, and you also might see some adjustments as it relates to drive-ups. So you're seeing some proposals for cars to come up and maybe get served in their car, or some modifications to restaurants. So that's also being discussed. Nothing's been changed yet on the health order today, but we are discussing it in over the course of this next couple days. So that's what you're seeing as far as changes. We want folks to have a safe weekend. I'm going to let Kelly Colopy now discuss some additional information as it relates to where we land with our regional and state partners and what indicators we're looking at to see how we can reopen safer as we move ahead. So, Ms. Colopy.
Thank you, Mayor, and good afternoon, everybody. We get a lot of calls and emails saying, you know, when can we open this? When can we open this? And then you're starting to see in media, through newspapers, social media, and others, that there are other jurisdictions where people are being able to open things that we're not allowing in the city of Long Beach. So I want to share a little bit about the process. The state has developed a process for which people can move through the phase 2 more quickly. And we'd like to share with you sort of what that looks like moving forward. So. As you know, the governor outlined stages of when the state can reopen, and right now we're in early stage 2, which is for low-risk businesses. Everything that is opening with requirements to meet distancing and safety guidelines and other modifications. But the kinds of things you've been hearing about are curbside retail, manufacturers, logistics, childcare, office-based businesses, car washes, pet grooming, landscape companies. Those kinds of things have been allowed in the early phase, but many of them still require, you know, face covers and distancing and those kinds of things. On May 7th, the state issued what we call a local variant opportunity that acknowledged that many rural counties that are not hard hit by COVID-19, many rural counties have had very few cases moving forward, and so they were being really impacted by, you know, their local business without experiencing the issues around COVID. So the state set some criteria that those counties could work to meet and to demonstrate that they could open safely, and it allowed them to move more quickly through phase 2. And so a number of counties, what we're calling, attested to what that looks like, and so they have been able to open. None of those counties have been able to move into the stage 3. So counties who met the variants, they can with the new safety protocols and modifications, can also open things such as destination retail, like shopping malls and swap meets, dine-in restaurants, and schools. So you may be hearing that, like I've heard in Sacramento, there was something saying that maybe some small fitness centers or different restaurants or things are opening. They can't fully open, and they have to show that they're meeting the distance requirements and other safety protocols. And as I said, at this time, no business can move into the stage 3, which are things like salons and tattoo parlors, gyms, like large gyms and fitness studios, indoor museums or libraries, community centers, pools and playgrounds, nightclubs and concert venues and other live audience kinds of things, theme parks, and higher education. They all fit into stage 3, and no one is allowed to move into those at this time. Recently, the state announced new criteria that allowed more urban counties to apply and to be able to move more quickly through phase 2. Counties must attest to their ability to, that they have local stability of their cases and that they have specific levels of preparedness. And those guidelines really focus on your shelter capacity for people experiencing homelessness, stable hospitalizations and the ability to meet a hospital surge, your testing positivity rates, your testing capacity, and supports for skilled nursing facilities. So that you're going to see a table that basically shows where we are for each of those. So for our shelter capacity, we do have the capacity to shelter 15% of our persons experiencing homelessness were we to have an outbreak, so we've met that criteria. We have stable hospitalizations. We've had less than a 5% average increase over the last 7 days, so we have met that criteria. The positivity rate has to be under 8%, and we have not met that criteria. Our testing capacity exceeds the 1.5 tests per 1,000 residents, so we've met that. And we have the ability to handle a 35% surge for our hospitalizations. We've met that criteria. In terms of skilled nursing facilities, we must have plans in place to address outbreaks in all the different facilities, as well as a 14-day supply of PPE for each of our long-term, our skilled nursing facilities. And we are developing the capacity to do that. So we've not yet met that criteria either. So I just, those are the key elements that we are tracking on as a city. We're working to ensure that we're maintaining the criteria that we've already met and building our capacity for the others. So we are tracking these elements, but the state is requiring that we align with LA County. So while we're not there yet either, we can't open as the city of Long Beach as a health jurisdiction. Right now, we are really tracking along with LA County moving forward. We have there are about now 50 counties that have been approved. The more urban and large jurisdictions have not been able to meet the criteria, which include LA County, Orange County, San Francisco, and our city of Long Beach as well. But we'll be keeping track of the indicators, and we'll keep you updated as we make progress, and also our progress to be able to attest as the city of Long Beach.
And so just to add to that, I think it's really important because we're getting a lot of questions about that as well. Is that there was earlier on weeks ago there was questions and back and forth as to whether because Long Beach has its own health department, whether or not we could move separately of LA County if we were choosing to go through this kind of expedited process. And so that is, I think, a question that the health department's been asking. I think a lot of folks, because we had our own health department, were getting indications that yes, if we ever met those, which we have not ever yet, obviously, could we move faster? So the response that currently the health department has received from the state is that that counties is what they are using, not individual city health or health jurisdictions. And so Pasadena, even though they have a health department, they have to meet the LA County health indicators. Long Beach, the same. And so what I think we can say is that certainly today doesn't make much of a difference, because even if we were counted on our own, Long Beach does not meet any requirements to move any faster. However, could we be meeting those requirements maybe a couple of weeks from now and be in a situation where we've met the state's requirements as a city, but when we're included in the county, we don't meet those requirements? And that's something that could happen in a few weeks. We're not sure. And so we are working with the state right now. We've made the requests as well. But because we have our own health department, the city of Long Beach believes that we should be treated as our own health jurisdiction. And so we're having a positive conversation with the state about this right now. So, obviously they have set guidelines, and it's not an issue for today, but it certainly could be an issue in the weeks ahead if Long Beach continues to kind of have better health indicators than the county as a whole. And so that's what we're looking at right now, but we're going to keep pressing hard to meet all these indicators, and then because that will help us make our case, I think, stronger. And so that's where we're at right now. And I want to just kind of end and then take questions by just reminding people that while we haven't seen enormous a spike or a surge, which were the two issues that we were looking at, just remind folks that this is a serious disease. COVID-19, there's still no vaccine. It's still highly contagious, and the vulnerable populations can, as we can see, if contracted, can lead to death. And really, it could lead to death for anyone, whether someone's vulnerable or not, but especially those populations. And so I just ask that I know that that a lot of folks are restless. Trust me, I would love to spend this weekend, with big gatherings of friends and enjoying the sun with everyone in a way that brought us together. And I know that's not possible. So just please know that this is still a serious disease. But I do want to thank you because of your work, we haven't had some enormous spike in the city of Long Beach. And let's continue that. Let's continue to be safe, to keep each other in mind, to take care of our workers, and monitor this data. And we'll have a lot more information in the week ahead. And we expect, where we expect we're going to see some changes, as far as what's on the horizon, are the areas where the governor has discussed. We know that changes to our restaurant operations are on the horizon, which is why we're planning for those. That is something that we know is going to be happening next. And so that's what we're anticipating, and we're all working together on that. So thank you. With that, we're going to take any questions from the media.
First up, we have Haley from Press Telegram and Southern California News Group.
Hi, can you hear me?
Yes.
Okay, great. So my question is for Kelly. Can you just shed some more light on the two indicators? I think it was the testing positive rate and the plans for skilled nursing facilities that Long Beach hasn't met, and where we stand on those right now?
Yeah, so in terms of our positivity rate, it shifts a little bit as the data are coming in. We're at approximately between 9 and 10% is our positivity rate currently. So that's where, the way it's calculated is per 7 days. And so we're going to the point where we know that we have the most accurate and complete data, which is about a week ago. And at that point, it was approximately 9.5%. In terms of our skilled nursing facilities, each skilled nursing facility has to have 14 days of PPE as well as a plan for an outbreak, and we are working very closely with our skilled nursing facilities, and most of them do have plans for how, for in case they have an outbreak. The other pieces, many of them have PPE like at the facility, sufficient to meet the need. Others, we need to make sure as a city we have the capacity to backfill in case they don't have that. So we're just clarifying that all those are in place moving forward.
And the PPE one is going to be, I think, we're developing that, and we think that could be met, easier than the other one. And the other one I think is the one that I think the health department's really looking at, and that's going to be the harder challenge than the PPE development at all of our skilled nursing care facilities.
Next up, we have Rachel Jordan from ABC7 News.
Hey, so I'm wondering if there's any information on how many people are getting tested and if we're anywhere near close to reaching the city's testing capacity, and at what point, if at any point, will the city decide to open up testing for everyone and not just those experiencing symptoms?
Yeah, so at this time, we're averaging, right now our testing capacity is 1,100, and we are averaging somewhere between 750 to 830 per day on the days that all of our testing is open. The issue right now, as the mayor earlier mentioned, is the lab's capacity to actually run all those tests in a time that is quick enough for us to be able to track people and do the contact tracing and other pieces. So we are testing folks, but we want to make sure that the labs that we're utilizing can get those results back. Recently, the delays have been, they've been more like 5 days to 7 days, and that's not a quick enough turnaround for us to be able to do the work we need to do to be able to quarantine and isolate folks. You're hearing a lot about contact tracing. So we want to make sure the labs can meet those criteria, and at the point that they are meeting that capacity, we'll be able to open it up more broadly for anyone to test.
Yeah, and I think just to add to that, we were moving towards opening up more asymptomatic testing, but then this huge backlog at the labs happened as well. And we want to make sure that just everyone that is currently getting tested can get their lab results in an expeditious timeline. And so if that kind of backlog gets cleared, then we should have maybe some good news about that expansion very soon. But it's really a backlog question as it relates to the labs.
Next up, we have Kelly from the Long Beach Post.
Yes, I might have two questions for you guys. First is on the backlog. It sounds like the backlog is having a significant impact on our positivity rate. Can you talk a little bit about what the city is doing to address this backlog and when we can start seeing our numbers being more accurately reflected? And second question, some people might find it a little concerning that Long Beach is now being, with our own health department, we're now being lumped in with the county when we've been working hard to produce our own numbers. Can you talk a little bit about what the city might do about this if we're going to try to assert our independence on this as our own health department?
I'll take the second one. You do the first one.
Yeah, so I think in terms of the backlog, we are working very closely with the lab. So what we're doing right now is working to align the number of appointments to make sure that the turnaround time. So they're working on the backlog. We're working with them moving forward to make sure that the number of people who are being tested are meeting their capacities, and then as they're increasing their capacities, we'll be aligning the number of people who can be tested. So we see it as a short-term issue. The labs are telling us that within a week or so that the backlog should be completed and then moving forward. So we're very hopeful that will be addressed very soon. And I think, Mayor, you want to talk about that?
Yeah, I mean, first of all, we absolutely should be. We should be evaluated on our own as a city. I mean, there's no question about that. And so there's only 3 cities in the state that are having this issue, Long Beach being one, because we have our own health jurisdiction. And so I think you're absolutely right. The staffs are talking. They've made it clear. We're having some conversations. Obviously, this is something that I personally have talked to key staff in the governor's office, and at the next opportunity where there's going to be some opportunity for me to have some further discussions, we're going to push this very, very hard. The staffs our staff is already working with the state staff. They understand what our position is. Same thing with the governor's staff. They understand what our position is. And I'm optimistic that we can resolve this issue because we're very unique. So we understand that there are only 3 cities in the state that are in this position. And we also understand, I think what we're being told is, hey, we get that, but you haven't even met the indicators even on your own. The issue is what happens when we meet those indicators possibly a week, 2 weeks, 3 weeks from now. And so I want to make sure that we never get to that place, but that we figure out this issue now so that if and when we meet the indicators, we were able to make our own decisions independently of the rest of the county. Because obviously we draw up our own health orders separately of the county. We draw up all of our own health guidelines separately of the county. That is the way we operate. And so we should not be lumped in to the county just on the key indicator piece. So we know that's a newer program. So we're going to push to make sure we get the adjustment. The reason why I'm more optimistic is that this indicator program has seen changes the entire time. So they keep adjusting it. The indicators change. The requirements of what they're expecting from cities and counties change. And so this is something also that needs to change as well.
That concludes our questions for today.
Okay, thank you. Let me go ahead and do the recap in Spanish.
Muchas gracias, alcalde García. Y gracias, directora Kelly Colopy. Muy buenas tardes a todos ustedes. Gracias por acompañarnos hoy, esta tarde, viernes. Queremos empezar con nomás recordándoles que este fin de semana que vamos a conmemorar el día de Memorial Day, día feriado. Por favor, recuerden de celebrar de manera segura y responsable. También empezamos con nuestros números. Desde hoy tenemos 1,513 residentes que han salido positivos al coronavirus. Alrededor de 1,024 personas se han recuperado. Y desde nuestra última sesión informativa hemos perdido a 5 personas adicionales a este virus. Todos tenían condiciones de salud subyacentes y en total esto eleva al número de nuestras muertes del coronavirus a 70. 55 de estas muertes se han asociado con los centros de enfermería y de atención de largo plazo. Como hemos expresado varias veces y continuaremos recordándoles a todos que esta emergencia de salud pública, abordar coronavirus y la salud y la seguridad de nuestra comunidad sigue siendo nuestra prioridad. Nuestro dedicado equipo de empleados de la ciudad de Long Beach continúa trabajando las 24 horas mientras enfrentamos esta pandemia y seguimos navegando juntos por esta crisis sin precedentes. Hace un par de semanas compartimos unos análisis de nuestros datos hasta el momento y hoy nos gustaría proporcionar una actualización de dónde estamos desde hoy. Comenzamos con una actualización de nuestros suministros de equipo protectivo personal, que nuestro inventario se mira muy bien. El PPE, o como lo conocemos en español, es equipo de protección personal. Desde marzo hemos proveído 60,000 máscaras N95, casi 30,000 máscaras de cirugía, casi 30,000 vestidos de protección para los centros médicos y casi 13,000 coberturas faciales. Desde que declaramos nuestra emergencia de salud, hemos aumentado los suministros y seguimos también colectando más para que nuestro inventario sea suficiente por los días y semanas que siguen. Distribución de PPE siempre va primeramente a nuestros primeros respondedores, los centros médicos, instalaciones de cuidado a largo plazo y de enfermería, y también a los refugios para personas necesitadas. Continuamos analizando la cantidad de casos y de muertes del coronavirus. Y algunas de las imágenes que vieron hace un momento cuando presentó el alcalde García nos enseña que estamos encima de la tasa estatal para ambos casos, pero continuamos nuestra tendencia por debajo de la ciudad, los números de la ciudad de Los Ángeles y también los números de muerte del condado de Los Ángeles. Nuestras pruebas para el coronavirus. Hemos aumentado considerablemente nuestra capacidad de pruebas con 6 sitios de prueba. Hasta ahora hemos realizado más de 27,000 pruebas del coronavirus. Anticipamos que los números reflejados en el área sombreada que vieron en la imagen de la tabla aumentará a medida que lleguen los resultados de las pruebas pendientes y se evalúen personas adicionales. Como les hemos dicho en los días anteriormente, que han habido algunos atrasos en los laboratorios para recibir nuestros resultados. Eso significa que vamos a ver un aumento en los números y los casos positivos. Ahora, para nuestros números de hospitalización activa de los últimos 60 días, hemos visto un ligero aumento durante la última semana en el número de hospitalizaciones. Este número se ha mantenido estable. No hemos visto un gran aumento en hospitalizaciones. Sin embargo, esto significa que todavía estamos viendo personas con complicaciones graves del coronavirus y debemos continuar haciendo lo que podamos para proteger a aquellos que puedan tener un mayor riesgo de complicaciones que pueda causar que ingresen al hospital. Durante esta etapa también hemos mantenido nuestra capacidad de camas en el hospital. Tenemos un total de 1,500 camas de hospital disponibles por toda la ciudad de Long Beach. Hemos visto en nuestros hospitales y las tendencias de la unidad crítica estabilizarse. El uso de nuestras camas es aproximadamente del 60% en capacidad normal, y eso no incluye nuestras camas de sobreextensión. Tenemos más de 300 ventiladores. Solo alrededor del 30% están en uso, por lo que también tenemos capacidad en eso. Como podemos ver también en una de las imágenes es que, ¿qué significa esto para nosotros? A medida que continuamos a través de la fase inicial o en la etapa 2, como ha conseguido el gobierno del estado, no queremos acelerar el proceso y ver que nuestros números aumenten. Sin embargo, continuamos monitoreando los datos e identificando lo que podemos hacer para aliviar las restricciones. Para unas buenas noticias, también en unos pocos días tendremos más información sobre los otros negocios que tendrán oportunidad de reabrir sanamente y responsablemente, y también algunos datos y información sobre celebraciones como en estilo de un desfile. Tal vez han visto por la tele, en las noticias, y por ejemplo podemos practicar sanamente y responsablemente algunos desfiles para celebrar muchas graduaciones que van a estar en estos próximos días y semanas, y también como para celebraciones como para cumpleaños también van a poder demostrar esas celebraciones responsablemente sobre desfiles, pero tendremos más información en los próximos días sobre eso. Ahora, algunos datos también que vienen del estado de California sobre la etapa 2. Estamos viendo que estamos muy temprano, en el área de muy temprana de la etapa 2, pero queremos platicar un poco sobre las aberturas con modificaciones, unas ventas de negocios minoristas con opción de recoger en la banqueta o en la calle, como hemos visto recientemente, negocios de logísticas, cuidado de niños para aquellos fuera de la fuerza laboral esencial, negocio basado en las oficinas, servicios selectos como lavado de autos, aseos de mascotas y de jardinería, museos que tienen áreas al aire libre y espacios de galería abierta y otros espacios públicos con modificaciones. Desde el 7 de mayo, California emitió una oportunidad de varianza de reglamento a través de un proceso de autocertificación del condado para cumplir con conjunto de criterios relacionados con la prevalencia y preparación de enfermedades. Esta varianza permite que los condados y las jurisdicciones adopten aspectos de la etapa 2 a un ritmo y en un orden determinado por el oficial de salud local. Originalmente fue diseñado para ayudar a los condados rurales que tenían pocos casos o ningunos o muy bajas muertes para poder demostrar que estaban seguros de abrir más rápidamente que el estado en general. Todos los condados aún no pueden pasar a la etapa 3 de la apertura. Aquellos que solicitan la variación pueden avanzar más rápidamente a través de la etapa 2. Sin ella, los condados pueden moverse al ritmo del estado. Pero recordamos que estas son áreas rurales pequeñas con el número de población más bajo, no como nuestras ciudades grandes o condados, ciudades donde hay demasiada gente y todavía no es saludable o responsable en reabrir. Etapa 2 ampliada con certificación. Los próximos cambios en la orden de quedarse en casa moverán todo el estado metódicamente a través de la apertura aún más. Los condados con certificación de variancia pueden progresar para abrir estos sectores más rápidamente de acuerdo con su plan de modificación especificado del condado. Todavía no está permitido la etapa 2 servicios personales como salones de belleza, salones de tatuajes, gimnasios y estudios de ejercicio aquí en nuestra ciudad. Los interiores de museos todavía no son permitidos, centros comunitarios que incluyen piscinas públicas, parques infantiles y áreas de picnic, por servicios religiosos y ceremonias culturales de capacidad limitada todavía tampoco no son adecuadas para reabrir. Discotecas, sala de conciertos, audiencia en vivo, deportes, festivales, parques temáticos, hoteles, alojamiento para vacaciones y turismo, viajes no esenciales o educación más alta como universidades y colegios todavía en este momento todavía están por decir no podemos abrir o reabrir esos servicios. El 18 de mayo se lanzó la siguiente ronda de variación para los condados que puedan dar fe de cumplir con criterios específicos que indican la estabilidad local de la propagación del coronavirus y los niveles específicos de preparación del condado. La segunda versión cambios los criterios para centrarse en el crecimiento de hospitalizaciones, casos y tasa de positividad. Nosotros tenemos que llegar y seguir un criterio para la preparación para reabrir. En la última imagen que enseñamos, se pueden ver que en un momento donde estamos en la ciudad de Long Beach actualmente. Tenemos que prepararnos suficiente para una capacidad de refugio, por decir, las unidades de vivienda temporal para el albergue, al menos del 15% de los residentes del condado que se encuentren sin hogar en caso que haya un brote en esta población que requiera aislamiento, cuarentena de las personas afectadas. También nuestros hospitales. Los hospitales del condado debemos determinar que la prevalencia de los casos del coronavirus es lo suficiente baja como para contenerla rápidamente mediante la reintroducción de las características de la orden se permanezca en el hogar y el uso de la capacidad dentro del sistema de prestación de atención médica para brindar atención a los enfermos bajos y nuestros números y la capacidad del hospital todavía sea baja. La prueba de tasa de positividad, debemos tener las pruebas de positividad por 7 días menos del 8%. La capacidad de pruebas tiene que seguir alta. Debemos tener suficientes pruebas para el público. Sobre extensión hospitalaria, el condado debe determinar si la capacidad hospitalaria, incluidas las camas de los centros, los ventiladores y el PPE, esté a capacidad para la atención médica. Y instalaciones de enfermería especializada, que ha sido nuestro gran problema en la ciudad de Long Beach. Debemos mantener protecciones para las poblaciones vulnerables en nuestra ciudad, como esos centros que hemos tenido problemas. Y entonces estamos y seguimos rastreando los elementos y datos, pero actualmente el Estado exige que Pasadena, la ciudad de Pasadena, la ciudad de Long Beach, que son jurisdicciones de salud independientes, se alineen con el condado de Los Ángeles. Estamos trabajando para abordar esto. Aproximadamente 50 condados han sido aprobados. Las jurisdicciones grandes o más urbanas generalmente no, incluyendo al condado de Los Ángeles, el condado de Orange, San Francisco y también nosotros aquí en la ciudad de Long Beach. Todavía vemos algunas semanas mientras que podamos reabrir completamente. Esto es todo por hoy. Muchas gracias por estar con nosotros.
Y muchas gracias también por estar con nosotros. Por favor, tener un weekend que esté bonito con la familia. Have a nice weekend, everyone. Obviously, Memorial Day is Monday, the holiday, and so we will be back on Wednesday. So a little bit of a break, and we'll have more to share on Wednesday at 3 o'clock. Thank you.